It's Speaking with Gravity, and we're back for another episode with myself as one of your hosts.
It's your girl D.
Good morning, everyone. My name is Taisha.
And on this podcast, we talk about mental health and how everything affects everything. You know, when you sit down with the therapist, the conversation is different. And on this podcast, we try to make you think, make you feel, make you do what is best for you. I'm a therapist, but this isn't therapy. It's a podcast. And we have a disclaimer.
While we serve as mental health professionals, the information and content being discussed during our podcast is not intended to be utilized or substituted as therapy. The purpose of this broadcasting is to share our personal perspectives through open dialogue about various content based on our personal, educational, and professional experiences.
So, we have a new episode that we want to add to the podcast. We're going to call it QD of the Hour. QD of the Hour is quotable data, something that you can give to your family members, your co-workers, your colleagues, your friends, data that we want to present for each episode regarding whatever we're talking about. So I'm going to give you three today. In 2008, there was a Mental Health Parity Act that was passed into law that required health insurers to treat mental health and addiction exactly as they would medical and surgical care. Fun fact number two, only 44% of adults with diagnosable mental illnesses receive treatment. Fun fact number three, 70 to 90% of the people who seek proper treatment for mental health disorders witness a significant reduction in symptoms. So, D, if you can, explain what our episode is going to be about today in a nutshell.
So, in the nutshell, today's episode is entitled Get in My Bag Therapy Edition. The purpose of this episode is to really talk about and have an open dialogue of how to really prepare yourself for engaging in therapeutic treatment. So, just as for a metaphor, if you are going on a vacation or you're going to stay somewhere, whether it's overnight or for an extended weekend or maybe a week, you always are going to take a bag with you. So you're going to prepare yourself, and depending on where you're traveling to and what the purpose of that traveling is for, is what you're going to include in that bag. So, and when we apply that to therapy, whenever you're going to therapy, there are certain things that you need to really consider, and think about in preparation of what you are trying to achieve by going to therapy. So whether you're going to therapy for just support or whether you're going to kind of work through some issues, that's what the Get in My Bag edition is here to support you for. So how to get you ready to engage in therapy and really just elaborating and explaining what therapy is.
So, what's the first thing we need to hit them with when it comes down to like talking about therapy? Talking about therapy in general, what's the first thing a person should think about?
I think let's start off by explaining what is a therapist. I think people have sometimes a misconception about what a therapist is, and then what is therapy intended to do.
Yeah, a lot of times I'm telling somebody I'm a therapist. One of the first things I get is, what kind of therapist? And I always just like to say mental health, a mental health therapist. Also say mental health counselor. But just to go a little bit further and y'all can elaborate, my title is LPC, Licensed Professional Counselor. Just a couple of weeks ago, I was an LPCA, Licensed Professional Counselor Associate, which that person is under about 2 years of supervision. That's why they have the A added to it, and then once they get through that supervision and everything is approved, they're just a licensed professional counselor. But then we have a whole slew of other names. I know in other states it's called licensed mental health counselor. I seen it somewhere, and I'm not sure about the other stuff. Y'all want to kind of talk about that one?
Sure. So under the umbrella, I guess, of mental health professionals, You have, like Kervin said, a LPC. You have LMFTs, which stands for Licensed Marriage and Family Therapist. You have a LCSW, which stands for a Licensed Clinical Social Worker, and kind of like a LPC, a LMFT, a LCSW. They all go through not only undergraduate, but they complete a 2-year master's program. They get trained in specialized clinical hours. I think it's 3,000 hours, but that can vary per state and per discipline. They all sit to take an exam, and then after they pass that exam, they are actually able to provide not only therapy, they are actually able to provide clinical diagnoses, and they are also able to implement and create treatment plans along with that identified client. You also have psychologists and psychiatrists, and oftentimes I think a lot of people get those two disciplines confused. With the psychologist, they have a doctorate degree, but just simply in psychology, whereas a psychiatrist, they specialize in medicine. They can provide what we consider talk therapy, but they mainly assist the individual in not only identifying, but prescribing certain type of psychotropic medications to assist with whatever those mental challenges may be that they present at that given time. So they're simply a medical doctor. And then you have counselors. So you may notice a school counselor or an addiction counselor. And typically they, I think, complete 4 years of school. And then they also refer or source those individuals out, because some of them necessarily don't provide the clinical aspect. They don't provide diagnoses, but they can bridge that gap for the individual that they are servicing in that capacity or setting.
And then also, did you say psychiatrist? You talked about them?
Psychiatrists and psychologists.
And just they are the ones who are prescribing the medication.
The psychiatrists are.
Yes. So, but everybody, for the most part, want you to have live the optimal life. So we're all working together to see what is your best, what route to take that is going to be in your best interest, whether you're dealing with just a crisis or whether you're dealing with depression or anxiety or any of the other diagnoses. Do you have anything else you wanted to add to that?
I think we talk about and we identify what therapists are, and I like how we're giving examples, of course, of what you may see in terms of the credentialing. And what I mean by credentialing is the lettering that you see following the individual's name. So it's just as you may see Dr. So-and-so, when you see that those credentials at the end, it kind of lets you know what that individual is specializing in or what they've obtained their degree in. But I guess we kind of had a previous segment about this where you and Ty did about who is therapy for. So I want to kind of explore that. Why should a person really go to therapy, or what is therapy intended to do? Not necessarily why should a person go to therapy, but what is the purpose of therapy?
To help you with whatever issues you identify. Typically, and everybody don't always know the I can't always say this word, specifics of their issues, but they do know that there's a problem. They know that there's a change in behavior, whether it's I was this person, I like to be around people and now I'm not, or I used to enjoy doing things and I don't, or maybe it's, hey man, I never had a problem getting on the interstate, but now I cannot drive on the interstate. There's something going on with me. They might not say anxiety, they may not say panic, but they're going to give you different things that they're dealing with. So, and then sometimes, and I'm giving you like mental illness, right? But beyond that, you have people that are transitioning. I love to talk about transitions. Transitions are not necessarily easy. We assume that you go from being a teenager to being 21 is, it's okay and it's all good. But no, it's not. Now you have where you wasn't paying for insurance. Now you got to pay insurance.
Right.
Me Ty was talking off record, but when she made a move, a major move, she had more responsibilities at that point. And whereas it might be easy for one person, it's not as easy for another person. So you can just come in just for these transitions that you have in life and your crisis. Of course, there are crises. There's things that happen that we didn't know. We didn't know that the pandemic was going to happen.
Right.
We didn't know, if I go back further than that 9/11 was going to happen, and it affects people differently. When 9/11 happened, I was coming out of college. It was a big deal. I knew it was a big deal, but my life was centered around the fact that this is my last semester. I'm about to graduate, and I wasn't as scared as some other people was that was more familiar with politics and how the wars start and so on and so forth. So that would be some of the reasons that you could entertain going to therapy.
What's your thoughts?
I mean, Kervin pretty much said everything in a nutshell. Pretty much what you present with. I think it doesn't necessarily have to be a problem per se, but just some guidance and assistance on how to navigate through everyday life challenges or obstacles. Yeah.
All right, so basically just providing that emotional and mental support with, our professional experience, from an educational standpoint. And then the evidence-based practices that we are trained to really utilize. I think what you guys both indicated as you were exploring and giving the credentialing and all of these things, you're talking about years of experience. So this is not for an overnight process for us. This is extensive. A lot of us go through clinicals as well, and we are required to have continuous education. So even after becoming professionals or getting licensed, your educational aspects of that doesn't change or shift. And I think that's the beauty of being able to really go and get professional assistance. You know what I'm saying? It really sets kind of a standard. It's good to have your support systems and those people who you can talk to in your everyday life, but to really be able to do it in a space in where there is no judgment, where I may not know everything about your cousin or all of these things, but I'm really just getting life's perspectives from your own mind frame. So definitely looking at that.
And just to add, when I brought up 9/11 and the pandemic, that's not to say that your therapist is going to necessarily know, okay, what's going to happen next.
Yes.
We're all learning like everybody else, how the coronavirus was affecting individuals. I had death in the family. So we're experiencing some of the same things that everyone else is experiencing. But we can kind of look towards our educational background and experience and try to connect it all and go deeper. What is reality? Do I need to be so engulfed where I'm not able to leave my home? I left my home every day. I still went out and did what I needed to do. But there are some people who had overwhelming emotions with regard to this and just couldn't leave, nor didn't they want anybody to enter. Then you talk about the isolation that went on. And even with that, the longer we were in the pandemic, the more I realized that we were going to be affected. Because I was thinking about myself, okay, there's some isolation, but I got like family members, right? That my mom lived down the street from me. My brother's not too far from me. Neither one of my brothers is not too far from me. But what I didn't think about, my daughter, when she goes to school, they don't get playtime the way that they once did. I remember being going to recess. You didn't just play with the kids in your classroom. You got to play with everybody in that school or everybody in that hallway, right? So now you get to get other friends. But now they're so isolated. They're only in that little classroom. Their recess time is shortened. And then what about the people who don't have family members nearby? It's just them and their space that they're in. If they don't have to go to work, if they work from home, they're literally at their home. So the social isolation that we preach so much against, that we're having to kind of
Forced
engage
into.
in because of the pandemic. And you know, you begin to realize more and more how it affects, and you're able to navigate it a little bit better. Whereas someone who doesn't have this background, they're not going to necessarily think about it until everything is over with.
Right. And I
And they're
think
like, how I get here.
I like what you said, because I think sometimes too, when you're going into looking at, you know, what is a therapist, you know, what separates us or how do we function, the reality is we are skilled and professionally trained, but at the end of the day, we are still human too.
Oh, absolutely.
So you
Yeah.
know, I'm D before I'm a therapist. You're Kervin before you're a therapist. You're Taisha before you're a therapist. And I think the beauty of it is that we're still able to relate to a lot of the experiences that our peers are encountering. And so what I found, just like you stated, is kind of when you're going through these transitions, whether it's COVID, whether it's grief, whether it's you know, a loss of job or a loss of employment or a change in location or a change in schooling process, is that, you know, we being professionals, it was challenging for me even to implement some of the same techniques and practices that I may have shared with clients, you know, with my eyes closed, you know, do this and do this. But I'm seeing, okay, it's not as easy when you're experiencing. And I think that's what keeps us, you know, humanized and being able to kind of recognize that, you know, calling things and recognize what it is. And that's the importance, I think, of getting in your bag, is understanding that you have somewhere that you're trying to get to, and what you're something that you're trying to achieve, and somewhere that you're trying to go. But you also have to understand where you are presently, right?
Yes.
Where you are right now. So it's not about just you know, your destination, but really, where am I, and what is my purpose for being where I am? So, you know, am I traveling for leisure, or am I traveling for, you know, business? Whatever the case may be, it's the same thing in your therapeutic practices. Is this about me personally, something that I want to achieve, or am I looking at it as a whole aspect of life and who I am? So I definitely can definitely appreciate that concept.
And people everybody don't know why. They literally don't know why they're coming in all the time.
Mm-hmm.
I guess that's where our professional experience would come in at. But just, you know, even if you don't know, if you just got some type of curiosity, just go check it out. And some questions that we're gonna ask, be that from, you know, whatever form that we got, or just from experience. The questions that we ask, I have you really thinking like, whoa.
Yeah.
Never thought about that, or I didn't know that affected me in that way. So, what do you look for in a therapist? What should somebody look for in a therapist? Because if you're gonna be with that therapist, man, I think we all can agree to this, and we've all heard this. The one of the most important things when it comes down to therapy is that working alliance, that therapeutic alliance. Somebody that's going to work with me to better myself. Whatever goals that we've set, we're gonna work together to get there. That doesn't mean that person is going to give you. I'm about to hit the table. A therapist can't give you the answer to all your problems. They cannot do that. They can't fix you necessarily. Oh man, I need to find this post about that. Therapists can't fix you, but they can be there to just kind of listen. Point you in the right direction, so to speak, help you figure out what your goals are. What is you said purpose. And purpose is so big when it comes down to life in general. Yeah, if you show me somebody who has no purpose, that don't think that they have any purpose, then I'm going to show you somebody who has a diagnosable mental illness. Because it's that heavy. I can't tell you exactly what it is, which one is going to be, but it's that heavy. Because we're all connected to something. We're connected to our kids. We're connected to our careers. We're connected to our goals that we have actually established. So purpose is really big. You know, it's one of the key things I like to look at. What are you passionate about? What do you love? Where are you going to be in the next year, 5 years, 5 weeks? So I kind of went off on a tangent, but what do you look for in a therapist? Oh, y'all just gonna do me like that.
I was going
In
there.
addition to what you said, having that therapeutic alliance or relationship, just meaning somebody you can connect with, that's really key because you have a right. If you notice that you aren't connecting with this individual who you've selected to assist you on this journey, you can leave. Somebody who's trustworthy. Definitely the credentialing component. You want somebody who is trained professionally to assist you again with whatever problem or problems you present. Even just simple things. Once you go into their office, looking to see if their license is visible. As a mental health professional, my license needs to be visible so that my clients can see, hey, I am a licensed master social worker who I'm striving to become an LCSW. That's the main thing, building that therapeutic relationship, understanding that the person who you are becoming vulnerable with, they're not judgmental, they're creating a safe space for you. Understanding that, asking your therapist, what are your specialties, what are you trained in? I think asking those questions again can better assist you with identifying whether or not this professional is a right fit for you and your problems. And we as the therapists should be aware of that as well and not practicing outside of our scope. And I think majority of us are good at that, meaning if I can't assist you, I'm going to do my due diligence by providing a great referral to someone who can better assist you in the areas that you are presenting. And understanding that we are all trained in various approaches, so our responses and solutions may be a little different based off of how we interpret your problem. So how I may assist you with working through your areas or problematic areas, D may find a different approach and Curvin may find a different approach, still utilizing evidence-based theoretical practices, but we still may take different approaches. I may do talk therapy, whereas D may give homework assignments. Therapists do the opposite. Figuring out, again, that therapist finding their niche and also you knowing whether that person is a good fit or not. You leading the session, you coming in, you're the boss. We're just the experts in a sense of assisting and guiding you along the way, but you're the expert in your life and knowing what it is that you want and what it is that you don't want. I like the phrase that I'm at every red light just checking in to see how you're doing. I'll see you at the next red light, but you're driving your car, you're navigating that vehicle, and I'm just popping in. Hey, how you doing? We talk, we discuss. All right, I'll see you at the next red light.
I gotta steal that one.
Yeah,
I like that one. That one
So,
is so dope.
I just think those are some things a person can look out for when they are looking for a therapist. Yeah.
And when you're for the relationship that you're describing, that person really need to be on point with you. They need to understand your values. They need to understand your experiences, your beliefs. That's what we would call culturally competent.
Right.
But you need to have somebody that you don't have to explain X, Y, and Z to. Again, we was talking offline. I was talking about West Side, East Side, right? You don't want to have to go to a therapist and have to explain, well, the West Side don't like the East Side, and then have to go further. Well, why don't the West Side and the East Side like each other? Like, it's okay to explain it, but it gets annoying if you're having to do that with everything. You know, it's one thing for them not to know, a therapist not to know one part of your life, but for you to have to explain all of it because they're not competent in recognizing your values, your experiences, and your beliefs, is gonna put a barrier there.
It can. I don't want to say it's going to. I think it can. I think the importance of too when you're looking at therapists is the one thing of it is again, we're not all experts. So even though we may be of the same ethnicity, it does not mean we share the same experiences. I think whenever you're looking for a therapist, you need to look for someone who is willing to understand you, someone who is really open to your transparency, and just as any other relationship that you're developing, someone who is really listening to what it is that you're wanting to achieve. I think one of the main things of, like you mentioned earlier, is that we don't have the answers to your problems.
No.
But I am here to listen to your problems. So I think, really looking for someone who understands what you are identifying. I think one of the things I always try to say too is kind of like, I'm not here to put, the words out, write the words out for you. You know what I'm saying? I'm taking your own words, as we do in treatment. I'm taking your words to define what your goals are, what it is that you want to obtain from coming to see me. How can I best support you? Whether it's at the red light or whether if you need me as the whole navigation system, you know what I'm saying? Kind of turn by turn, because for some people that may be what they need in order to get them on the right track. And then, once they get to a place of, okay, now I know where I'm going, you may be able to turn me off. You know what I'm saying? You no longer need my assistance for that. And so I think, when you're looking into therapy and you're looking for your therapist, just kind of explore those things. You know what I'm saying? And I think I like what Ty said about asking them what they specialize in based on what it is that you need. What do you have experience in? And I think if you're dealing with a real true professional and someone who understands therapy, they won't get offended by that, because they understand that you are seeking to make sure that, I want to make sure you can help me, and that I am not wasting finances, because therapy is not the cheapest format. And it is it's a time and it's like a commitment, and really just making sure that person is available to you in terms of that. So really just creating that dialogue and that openness, I think, is very important in terms of what you should look for in a therapist.
And we shouldn't, a therapist can't provide therapy in everything. You're not going to know everything. Some of them have specialties, some of them are better at certain areas than others. I deal with depression and anxiety, but if somebody was to come in for, was it histrionic personality? Is it histrionic personality disorder? As you can very well see, I don't even know the whole word, so much less be able to actually give them some insight with that. We are ethically supposed to be trained in whatever we provide services for. So if you're coming in and you have this diagnosis, then I'm supposed to be trained in that area. It's a little bit easier if we're only dealing with the crisis, if we're only dealing with just bettering you. But to deal with a specific diagnosis, you need to be trained in that area. And it is important that you ask that person what, or get knowledge of what they're trained in or what they're used to providing therapy for. It's okay for you to say, so what have you dealt with my problem before? Have you dealt with somebody that has my problem?
I think really too, I personally believe, that's something that I should already disclose either during that consultation. And I'm not to say that one shouldn't ask, but it's my responsibility to let you know what it is that I offer up front. So then you can kind of determine whether or not we will be even a good fit based off of my levels of expertise and whatever situation or problem you're presenting. Yeah.
I like how you said that consultation thing. A lot of therapists do provide that consultation. It might be 15 minutes, it may be 30 minutes. And typically it's free. And that gives you a chance just to dialogue with them and get a feel for them, get an understanding of what they do, what the process is, and if you like them or not. You said it earlier, you're the boss in this situation. You can either hire me or you can fire me. Either way, you're in control. This is your life, and you need to pick the person that's going to be best for you.
And again, just really understanding you're leading the way. We're here just to assist. Because what we don't want is for your therapist to kind of take over the session and identify what problems they think you may have if you haven't disclosed those things. Now, what we can do is based off of the things that you presented, using our educational expertise, highlight, hey, based off of this group of things that you identify, it falls into this category. Let me continue to educate you on what this category of problems that you've presented is. And then from there, again, going back to that treatment plan, which is you simply identifying goals, and that's a navigation system for us to continuously check in each and every session to assist you with the identified problem or goal that you've listed on this treatment plan, and how do we address those issues, or enhance those, even if, simply how do we address those issues based on that treatment plan, in a therapeutic way.
And the question come to mind when you're saying that, though, about the therapist not taking over the session. Session should be about you first and foremost.
Mm-hmm.
That's your session. But what if somebody's not interested in therapy? What if they feel like, I don't need a therapist because I got good friends, I can talk to them, I got a good support system? What's up with that? If I had to start it off, I'd say, when you're thinking about friends, you know, the one thing that we do, and we're kind of doing it here, like on the podcast, but when you're with your friends, you don't always say the first thing that comes to your mind, because there's judgment there. Even though they're your friends, there's still some type of judgment there. Then you know how they're gonna feel. So if a person coming to me that's my friend, if I have a friend that's coming to me and we're real cool and he says something, I got to figure out how I'm going to say that, because we're friends, right? And I do have to do that in a therapeutic setting. However, I can be, a person can be a little bit more forthcoming, because it's just me. They paying me. I'm unbiased. Let me get this all out. I don't have to sidestep. I don't have to sugarcoat anything. I could just let it all hang. So that would be my little ordeal for people who say, I don't need therapy, I got friends. But what do y'all say about that?
For me, I think when you're really looking at, whether or not you should pursue therapy, I think one of the things you highlighted too, is really considering the aspects of judgment, whether conscious or unconscious. Sometimes when people think they know who you are and they know what you should or should not be doing, whether it's in the best interest of you or not, they're looking at it from that perspective, I think. But when you come in and you're sitting with a professional therapist, I'm seeing your world through your eyes based on your words. So I'm not interpreting, what you did back then or what you did, before that, or even what happened to you. I'm basically seeing the world through your eyes, through your own reality. And I think that's the beauty of a therapist, is that we understand that regardless of how we perceive the world, your reality is your reality. So your experiences and what happened to you and how you respond to situations is just that. Our mission and our goal is to really take your reality and offer you an alternative perspective, or expand or explore more. How did you get to the current, concepts of where you are as an individual? And then what can we do and where do you want to go with that thought? I think, when you talk about coming to therapy, our clients do lead the session in terms of the goals that they have identified, what we want to work in. But as your therapist, I lead the session in terms of how do we get to this point. So I'm adding the intervention methods that are going to be utilized to get you to where you are. So once you tell me what you want to work on, now I'm going to get us to that point. I'm going to help and aid you to how do we get to that. And so sometimes that may be, like you mentioned, homework. Sometimes that may be me exploring, questions. That may be me really adding or asking you about something that may be sensitive, or something that you may have not even realized or recognized as problematic. A lot of times when you're dealing with people who have a more passive personality, for example, they really don't see a problem with anything. So you know what I'm saying? So which
is a problem.
Right. And so when you start really exploring, okay, but how did that really make you feel? they will say that, but they'll be like, but it was fine. And that's where you're saying, but it was not fine, right? So really allowing you to set in your truth. And I think that's the beauty of a therapist, is that we really support you and hold you in your moment of truth, in your moment of transparency. Also, the confidentiality aspect. I can't get on the phone and call Shay and say, you just came in this session and told me X, Y, and Z. Because ethically, I'm confined to what you disclose to me to only be shared with me, unless for any reason you are intending to harm yourself or harm someone else. So for a fact, your business is not everybody else's
Right.
business when you come and talk to a professional or a therapist. And then I think the other aspect of that is, if like we've kind of said throughout this thing, if I can't support you in that way, I'm going to guide and connect you with somebody who can. For an example of this, I had someone who had an eating disorder, and the first time she came to me, I was like, I'm transparent from the first session. So I was like, this is not my area. This is not where, I have a skill set in. And I would be doing you a disservice to try to provide you services for that. And I think that's the transparency part that we were referring about too, is that when you're talking about or going into therapy, or what to look for in a therapist, or what if you're not interested in therapy, is think about that honest opportunity that we get to have. I get to be vulnerable with you. You get to be emotionally vulnerable, and I get to support you in that vulnerability. I don't get to judge you based on that. I have to check any biases that I have. And I think, you know what I'm saying, again, as we talk about continuous education, as we talk about culturally diverse, being culturally aware and conscious of things, I don't really have to interpret you, because I've been trained not to assume anything. So when you say something to me, if it's not clear, then I'm going to ask questions to explore to get your definition of it. And then when you define it, now I'm going to take your definition and apply it to, okay, how is this applying to your everyday life or your everyday decisions? And that's the beauty, again, of therapists. So it's not really, what if I'm not interested in a therapist? I think the question should be is, why are you not interested in a therapist?
Do you want to be challenged?
Right.
Are you ready to do the work? And that it is work.
It is work.
You said all the stuff that you just said, homework assignments, asking for clarification. A lot of times that clarification is hard within itself. Like,
right.
What do you mean? And they try to say what they mean, and then, okay, I'm not understanding. I need more. And they just kind of want to stick right there.
Right. The safe areas.
You got to go deeper, and when you go deeper, that's when it's like an aha moment sometimes. But yeah, clarification is big. So that being said, what's the once you change your mind and you decide, all right, I'm gonna go ahead and do this thing. We already mentioned consultation, right?
Right.
So if we're mentioning consultation, you talk to that person, you get a feel for the process, and I say get a feel for the process. If someone does a consultation with me, I'm going to kind of walk them through, hey, this is what you do. You set up an appointment, whatever. But what do I expect in that first session?
The first official session
after
the consultation.
After the consultation, which I define it as the assessment. And with that assessment, there's going to be forms that I have you fill out. HIPAA forms, basically saying I can't say nothing about nothing. And then there's that agreement. But more importantly is the information that I'm trying to gather to see where we stand. Where is our, I'm going to say baseline. That might not be the best word, but where's the baseline at? Where we starting from? And then where we're trying to go. And those questions can be difficult. Just depends on the person. Depending on how forthcoming you are in that moment or not willing to be. If you're not willing to be forthcoming, then I got to try to get deeper and deeper and figure out how I can get this information out of you. But that's what I would say in a nutshell. What the first things is going to happen in that assessment of that first therapy session.
I think it's important to recognize too, like you said, after you've had that initial consultation. I think that's generally you're going to see the consultation part when you're dealing with somebody who may be in private practice or who may be in an institution where, you know, you have more direct clinicians who are, like you said, licensed, independent. Thinking about it from the aspect of, you know, community-based mental health, the consultation part doesn't always occur. So when you're doing it from
when you say community, what you say community what?
Community mental health.
All right, break it all the way down so people know now what is community-based mental health like. Private, I guess we should say that private practice is, you know, kind of like a small business owner or up-and-coming business owner. Not necessarily small all the time,
Right.
but it's somebody who has the
Credentials
degrees, credentials to operate in this scene, and they decided to do it on their own, either on their own or with a group of counselors. And so they can create their own rules. But then you have the community
under the federal and state guidelines. They can create their own rules. So their process may be a little bit different. Their environment may be set up a little bit different.
I say free flowing.
Free flowing, freelance.
Yeah.
kind of their own maze of art. Versus the community setting, where generally with your community settings, they're going to be more state regulated. So the process is generally going to be consistent across the board with how they complete their assessments. Now, you do have like a, I can't even remember what the word of it is now. Like we used to have the little 30-minute assessment before screening. So you do have kind of like a screening with generally the community mental health environments, because
that person have to pay for that screening.
It can be billed if it's defined that you are in fact in need of treatment.
Okay.
Generally that's where they're getting a basis of what's kind of going on with you to determine if really you are if services are appropriate for you. So therefore, if not, so let's just say, for instance, you're coming to a community-based mental health provider because you need a place to stay. Necessarily, that's not a mental issue. So they may refer you back to, you know, at a housing authority or something of that. That during the screening process, if that's what your concern is and that's what you're experiencing, then you at that point would be deemed not necessarily appropriate for services. You see what I'm saying? Yeah. So you would be referred somewhere else, versus you coming in and saying you maybe have experienced suicidal ideation or whatever the case may be. Then you're going to be definitely approved for pursuing actual services. So it's just looking at what that looks like. So you'll hear different languages when you're in that private setting. You may hear it referred to as a consultation, but again, in like your community-based places or locations that are really oftentimes state regulated, you're going to probably hear it referred to as a screening. And sometimes that screening process kind of, you know, like you said, is about generally 15 to 30 minutes in terms of just kind of touching base, kind of go with that. When you get into your assessment is typically a little bit longer, generally an hour to 2 hours, in terms of paperwork, in terms of the questions that are being explored, dealing from, you know, where you stay at, to, you know, your backgrounds,
history,
everything.
medical history.
Yeah.
And when you say hour to 2 hours, it might sound 2 hours sounds like a long time.
Right.
But, you know, again, that depends on the person. You know, if you are a talker, it's going to be closer to 2 hours, because I ask you a question and then you take me from A to W, right? And I just want it from A to B. It's fine.
Yeah.
But that can take you into 2 hours. So, Todd, did you want to add something to that, or we're going to go to the next one? Okay.
I think you guys covered it pretty well, yeah.
So
I think you can, but I think you do add it because, you know, after you do your assessment, there are times too, depending on where you are, there are times when they may develop what we refer to as your treatment plan. So again,
same assessment.
Sometimes that is done at that point in time, and then sometimes it may be scheduled for your next appointment. So when we're talking about, again, getting in your bag, there are certain things that we're going to provide to you upon arrival. You know what I'm saying? That's going to be kind of like your check-in point. when you arrive at your destination, which is your therapy session. And so you're going to go through that stage as well. And again, I think Ty did a great explanation of really exploring what your treatment plan and your treatment goals are, where we're identifying what it is that you hope to accomplish during your time of service, and then we're identifying from a clinical perspective the interventions or the evidence-based practices or theories that we're going to apply to your situation to help you be successful in obtaining those goals. And then you'll go into your first therapeutic session.
And we don't always say, I don't think everybody in here say, this is your treatment plan.
No,
this is your assessment. Because ultimately we're trying to get information to be able to help you, and we're trying to respond appropriately. We're not these clinical terms that sometimes we throw around amongst each other, or maybe right here when we're trying to explain it. That's not gonna be in your session. It ain't gonna make you feel comfortable. All right, now I'm gonna do your assessment, and this is what I got.
Right.
Or let's do your treatment plan, and let's figure out how we need to get you better. I mean, no, we're not going to necessarily talk in that language.
But I think it's important to understand or recognize that language so that, because there are things that really don't change. And those are things that may be referenced throughout your time or your session. So, when we have our 90-day updates and things of that nature, again, that's from a therapeutic standpoint, but you will understand, okay, what's happening at this point? Why is she asking me, or why are we revisiting this to kind of see how things are going? It's part of our processing. So again, that's kind of the benefit of where you're coming, because when you're dealing with a professional therapist, we have things that we are required to do to make sure that what we are doing is working, right? Because the worst thing I feel like is to have somebody go to therapy for 3 to 6 months and we haven't done anything. There's been no work, and sometimes that will happen because ultimately the goals that were identified haven't been revisited, or this person has moved past that and it is in a different area. And so that's again the benefit of being with a professional is we have these requirements where we have to make sure we're still in alignment and professionally assisting you in that support. So we have our kind of check-in points, I guess as you call it, the red light. Sometimes when you're on the back road you don't hit as many red lights, but when when you get back into your city, that's when we coming in again and just kind of making sure everything is good. So, yeah.
So let's get to the nitty gritty. I'll pay for this. What is it gonna cost me? And just to be frank.
To be transparent.
What's the difference between frank and transparent? To tell y'all the truth. To keep it 100. So
just to be frank.
As far as the cost is concerned, it can be anything. Pretty consistently, you're gonna get between $100 and $200. But then you have what you call sliding scale fee. You have people who are aligned with different foundations and places where it may be under $100. Or you may even get a therapist who is competent, but they're new to this field, and so they're willing to kind of go at a little bit lower rate, because I have seen $85, I have seen $60. So it's feasible for you to get good therapeutic sessions and help for a lot of different prices. But again, like I said, for the most part, you're gonna be between $100 and $200, and either it can come out of pocket, which I would call private pay, or it can be your insurance that's going to provide that for you.
And I think we need to explore too the significance of kind of why people sometimes charge different prices. Typically, when you're going to see sometimes higher fees, normally that person may have more specified credentialings and things of that nature, which puts them at a higher rate. So you really have to, it's not that one person just really charging you what they want to charge you in a sense, but it's about looking at, what are my specializations and me knowing, the knowledge and background and skill sets that I have to be able to provide you. So sometimes cost is affiliated with quality, but not always. I don't want someone to assume just because they pay $60 for a therapist that they're not getting the same quality of service as somebody who's paying $200. It does not equate that, but sometimes because of credentialings and other things of that nature, people are able to charge a little bit more for the services that they're providing, because
And
of their level of expertise.
like I was saying earlier, trainings. We gotta
Right.
have these trainings, right? And so I might get more training in a certain area. So when you come to me for that area, you're getting quote unquote the best of the best in that
right.
particular area. It could either be, and when I say training, it could be on a diagnosis, or it can be on like a therapeutic, how you say that, intervention, or like if I do CBT as opposed
Right,
to ACT, which is acceptance commitment therapy. And then just you go to get that training, and once you get experience, you do become an expert in that particular area, and of course you want to be paid accordingly, but you're gonna have the results to go along with that.
Right.
And then, like I say, health insurance is able to pay for it. Usually, you'll have a copay. There's in-network and out-network. Going back to my fun fact, all of this, I ain't gonna say all of it came about, but a good bit of it came about after that. What I said was the Health Act, because I remember learning in school. See, I went to school before you guys. So I remember different set of rules to some degree, but I remember us talking about brief therapy and having to do sessions in a certain amount of time, and then having to be pre-authorized for it. And if it wasn't in a certain little area, then you wouldn't get pre-authorized for that. And that was when I was in school. But some of that has changed. It was called the Mental Health Parity Act. That's what I was trying to say. But insurances now do pay just like your dentists and medicals. They pay in network and out of network, and you would have to call to see what your insurance company does. Was there anything else about pay?
I think it's important, like you said, just highlight again, checking with your insurance provider to see if in fact mental health services are covered, and then how often or how frequent those services are. Sometimes with the insurance providers, you, like you said, may have a copay. There may be a certain amount you have to pay, and you may also be limited in your sessions. So these are things to also be considerable about, and this is why you want to be really specific with the type of therapist that you want to utilize, because you want to make sure that that person is really able to grasp what you are hoping to achieve in your treatment, and that's why it's important to really, I know you may not have all the answers, but really think about kind of proactively what it is that you hope to gain from therapy, because it does have a cost. It can be expensive, and you don't want to take time really having to I won't say waste sessions, but really go through sessions that don't really address what it is that you're trying to achieve. So being kind of conscious of that, checking in with it, and then making sure also that you understand, or share your cause concerns with your therapist. Therapy's not cheap, but I think you also need to be transparent. If there is a cause concern, because as we kind of talk about, once we do your assessment and things of that nature, the frequency of how often you may engage in therapy may be, it's generally going to be decided based on, what our recommendation is. Typically, it may be once a week, it may be twice a month. As you continue to progress and grow, it may expand or decrease to once a month, ultimately ending where you're not needing that support. But really understanding that, every time you meet, that's classified as a session. You know what I'm saying? So understanding how many of those you have, and then what that's going to look like you from a financial aspect. I've had clients who they could have benefited from seeing me once a week, but financially wasn't in that place. So what we're going to do is I'm going to see you this once a week, and then this week we're going to really just do some homework assignments, or we're going to do something to really support you through that transition, and that way when you're coming back we're referring. So really exploring and expressing what's going on, because I never want to put a person in a situation or have somebody stop seeing me because they couldn't afford it. Really looking at what that cost is going to look like for you, and from a personal standpoint, because everybody don't have insurance in that.
Yeah.
That's why
That
I
cover
think
that.
again the therapeutic relationship is so important, so that people feel comfortable with sharing those things. Some people can be prideful, you
Right.
know, and if they feel like as if they're walking into a judgmental space, they're gonna retreat and shut down and may not even return. And two, I think that's the importance of why we as therapists ask and explore a lot of questions to better understand the scope of your problem, what's troubling you, and understand what your goals are, expectations are for coming to see us, or you know, for what life will look like for you when therapy ends. So yeah, just having that therapeutic alliance and us being able to dialogue frequently about really why you're here, so that one can feel comfortable if cost becomes a concern. And we offering, like Kervin said, sliding scale fees. Yeah.
And also, if your insurance if you do use your insurance, there has to be a diagnosis that goes along with it, which is why they would pay. They need the diagnosis to say, oh, okay, we're going to pay. If you pay private pay, there doesn't necessarily need to be a diagnosis, and you can just work on whatever issues that you have at that time. So how do we go about finding the therapist? I Well, you know, everybody gonna do this. Google. Everybody's gonna Google therapist, and therapists are trying to put themselves in a position so that you can find them on Google. You can go beyond the first page, but a lot of people probably not. But you can go beyond the first page of Google, and you can find people near you. You can find people in your state. You can find people in other states. People are licensed in multiple states. I'm currently on a license in South Carolina. But right now, the process is you have to go through each individual state to become licensed. And there are therapists out there who are licensed in multiple states. So with that being said, you don't have to necessarily get somebody in your town or even in your state if that's an issue for you. I ain't gonna say it shouldn't be, because we have to keep everything confidential, but it just may be your preference that you don't want nobody in your area, and that's definitely feasible with teletherapy and all of that. Teletherapy meaning you can do therapy online. So definitely Google social media. Social media is one. There are therapists out there who have accounts where they identify themselves as therapists, and they're giving out information to kind of lead you into that path, and they're willing to be contacted, not for therapy, they can't do therapy on that
Through
platform,
that platform,
or
right.
through that platform, but you can get in contact with them, and they can tell you what the next steps are. And then of course there are directories. Open Path Collective, which concentrates on people who need cost-effective therapy. Psychology Today, Therapy for Black Girls, Therapy for Black Men, therapyforblackgirls.com, therapyforblackmen.org. Good Therapy, BetterHelp. Some of these I hadn't even heard about. Network Therapy, FindATherapist.com. I didn't even know that.
I think
that existed.
it's evolving. I think when we're talking about it now, I think from one of our previous episodes, what we identified is that people sometimes know they need therapy but don't know where to look for it at, and so I think that's why you see these platforms coming up, is because you see people are now in need, and there are therapists, mental health supporters who are out here. So I really am glad that the list is growing.
Yeah.
In terms of it, and really just giving people the option to be able to look in multiple spacings in multiple areas to actually be able to locate their direct services.
Therapytribe.com and Theravive.com. I had those written down, but I'm gonna have to try to find a way to put these into so people can have access to them. What else we got? That's it. How to locate therapy. That's what we at. We done. Oh, it was what they said on the Breakfast Club. My man say, "Is we finished or is we done?" All right. So once again, I'm your host, Kervin Searles, and You're listening to Speaking with Gravity. We are on Facebook. We're also on Instagram. We are not on Twitter, but we may get there one day. If we said something, and hopefully in this particular episode we said something to encourage you to seek therapy or be able to talk to someone else about it. If you need help finding something, a therapist, just send us a message on that platform and we'll try to point you in the right direction. Thank you to Vision Winning Productions for all they do in helping us to get up and running. Thank you for taking the time to listen to us. You could be doing anything else besides this, and you chose to listen to us, and we appreciate that. I do want to give a shout out to all of those people who have, contacted me directly and said, hey, I enjoyed the podcast. And thank my mom for listening. Of course, my wife, my sister-in-law. I've had friends that listen. Shout out to Junior. Junior know who Junior is for listening. Junior does not listen to stuff like this, but he listened to me, and I appreciate that. Y'all had anybody that y'all in particular, people who have we have reached out to give us feedback? We really appreciate that, because we're not just here just to hear the sound of our voice, right? Like we want to give information. We want to give you what it is that you want to know. If you guys got something that y'all want us to talk about, let us know. We'll do the research on it. Y'all want to add anything to that?
Yeah, I think we hit it.
Remember, we're therapists, but this ain't therapy. It's a podcast.